Hello guys, welcome back to my YouTube channel. Today's video is what is urgent care EMR. So urgent care EMR basically a software solution enables urgent care doctors and practitioners to efficiently manage the heavy workflow of urgent care centers. In addition, urgent care EMR software can be complicated with various significant templates such as workers compensation forms and work accident forms. In the US, urgent care and EMR are different entities. The idea of urgent care is to take some of the pressure of hospitals. Somehow the ER have become a de-facto primary care office that is not their intent. Heart attacks, MVA, SOB, and strokes, acute respiratory issues, acute traumas, illness, a true emergency. In ER is not meant to be used for things that can be taken care by your primary care provider. Urgent care are used after hours, weekends, during the day when you cannot see your PCPs. A trip of the ER is very expensive and may not be recovered under the insurance, especially if it is used for non-pregnant issues. Your PCP urgent care should be your first stop. Save the ER is a true emergency. So what services does urgent care centers offer? Before visiting an urgent care clinic, it's important to familiarize yourself with the services they offer. This will help you save time and ensure that you receive the necessary care. If you have a medical emergency, urgent care clinics are the best option for you. They have high trained doctors and physician assistants who can provide treatment for their minor and severe conditions. So this is the Apex urgent care. The list of the services offered by urgent care clinics. OPEX. You should consider visiting urgent care clinics for minor and acute medical conditions, and immediate assistance for the patients related to the acute illness or injuries, medical examination, COVID testing, routine preventative health services, diagnostic care, treatment by symptoms, illness and injuries, implanting sprains and fractures, treatment burns, seasonal fevers or infections. If you need immediate medical attention for a serious illness or injury, urgent care centers provide prompt treatment and do not require an appointment to see a doctor. They can be a more convenient and cost effective option if you are unable to see a regular doctor. Why is urgent care clinics in USA are slow? A few of many times I went to the ER. I was making dinner which involved slicing pions and they have an mandelion. I was using the hand card but I slipped. I reasoned my finger off and applied pressure. After 45 minutes it was still bleeding. I went to the ER where the trig nurse told me to keep my hand over my head. She asked if it was okay to be seen by PA physical assistants rather than MD. I have seen in 15 minutes my finger was numbed and depressed and I was given an antibiotic shot. In 2016 I was released from the hospital after my kidney was removed away too soon. I knew I would end up back in within infection. The hospital where the surgery has done was a 45-minute drive for my 80-plus-year-old father. I was released late Thursday evening. I was getting home health care of dressing charge, physical therapy and assistant bathing. Sunday night I was shivering and felt alternately freezing and sheltering. My internal thermostat is messed up and I was always warm. The air conditioning has to set at 68 Fahrenheit. My pulse was high, my blood pressure has low as my oxygen levels, but I did not have a fever. Since the nurse has due to at noon, I decided to just wait for her, and she took one look at me and called 911. I had sepsis and was in hospital only 15 minutes from home for over a week. I did not remember the ER. I went to the EMS gurney and isolation room in the ICU. I was in summer in college, living in the dorms. I was getting an intermediate, extremely painful upper abdominal pain, usually Saturday